1. Which of the following is the primary purpose of the Mini Mental State Examination MMSE? A. Diagnose depression. B. Assess intelligence quotient. C. Screen for cognitive impairment. D. Determine neurological deficits. 2. What is the maximum total score a person can achieve on the MMSE? A. 20. B. 25. C. 30. D. 35. 3. Which cognitive domain is not directly assessed by the MMSE? A. Language. B. Orientation. C. Visual spatial skills. D. Long-term memory. 4. The MMSE is most appropriate for screening which of the following conditions? A. Schizophrenia. B. Dementia. C. Anxiety disorders. D. Bipolar disorder. 5. Who originally developed the MMSE in 1975? A. Beck and Steer. B. Fulstein, and McHugh. C. Kaplan and Sadek. D. Piaget and Vygotsky. 6. How many points are assigned to the orientation to time section of the MMSE? A. 2. B. 3. C. 5. D. 6. 7. In the MMSE, asking a patient to count backward from 100 by sevens is a test of which cognitive ability? A. Abstraction. B. Language. C. Attention and calculation. D. Executive function. 8. Which MMSE item tests short-term memory? A. Naming objects. B. Repeating 3 words. C. Recalling 3 words. D. Following a 3-step command. 9. Which of the following tasks is scored under the language section of the MMSE? A. Drawing intersecting pentagons. B. Naming a watch in pencil. C. Repeating a sentence. D. Calculating serial sevens. 10. How many points are given for correctly following a 3-stage command, e.g., take a paper in your right hand, fold it in half, and put it on the floor? A. 1. B. 2. C. 3. D. 5. 11. A total MMSE score of 24 or less typically indicates A. Normal cognitive functioning. B. Mild cognitive impairment. C. Moderate to severe depression. D. Possible cognitive impairment. 12. Which of the following factors can falsely lower MMSE scores? A. High education level. B. Multilingualism. C. Visual or hearing impairment. D. Repeated administration. 13. Which adjustment should be considered when interpreting MMSE scores? A. Patient's race only. B. Patient's gender only. C. Patient's age and education level. D. Patient's blood pressure. 14. A patient scores 29/30 on the MMSE but has clear signs of executive dysfunction. What is the likely limitation here? A. The test overestimates impairment. B. The MMSE is sensitive to mood disorders. C. Executive function is not comprehensively assessed by MMSE. D. There was a scoring error. 15. Which domain is most often preserved in early-stage Alzheimer's disease, potentially leading to a deceptively high MMSE score? A. Orientation. B. Naming. C. Recall. D. Construction. 16. A 72-year-old patient has an MMSE score of 22. What is the best interpretation of this score? A. Within normal limits. B. Mild cognitive impairment. C. Possible dementia. D. Score is invalid without imaging. 17. You ask a patient to write a sentence. What would qualify as an incorrect response on the MMSE? A. A grammatically incorrect sentence. B. A sentence with spelling errors. C. A sentence with only one word. D. A sentence that is not related to the prompt. 18. If a patient refuses to attempt a portion of the MMSE, the best course of action is to A. Score the section as incorrect. B. Skip scoring that section entirely. C. Estimate the score. D. Repeat the instructions more firmly. 19. How frequently can the MMSE be re-administered to monitor progression in a clinical setting? A. Daily. B. Weekly. C. Every 6 to 12 months. D. Every 5 years. 20. Which population might present with a lower MMSE score despite having normal cognitive function? A. College graduates. B. Illiterate elderly individuals. C. Middle-aged professionals. D. Children under age 10. 21. Which alternative test is often used to complement or replace the MMSE for more comprehensive cognitive screening? A. PHQ-9. B. GAD-7. C. Montreal Cognitive Assessment MoCA. D. Glasgow Coma Scale GCS. 22. Which of the following is not a limitation of the MMSE? A. Cultural bias. B. Low sensitivity for mild cognitive impairment. C. High cost. D. Poor executive function assessment. 23. Why might the MoCA be preferred over the MMSE in early cognitive decline? A. It is shorter and easier to score. B. It includes items assessing executive function and attention more thoroughly. C. It provides better mood assessment. D. It eliminates need for education adjustment. 24. The MMSE is primarily standardized for which language and population group? A. English-speaking, highly educated adults. B. Non-English speaking, illiterate populations. C. Children. D. Nonverbal adults. 25. In longitudinal cognitive assessment, the MMSE is most useful for A. Identifying causes of dementia. B. Monitoring response to treatment or progression of disease. C. Diagnosing psychiatric disorders. D. Evaluating pain tolerance. Mini mental state examination. The Mini Mental State Examination MMSE is a widely used 30-point cognitive screening tool developed by Fulstein, and McHugh in 1975. It is designed to assess various cognitive functions including orientation, attention, memory, language, and visuospatial skills. The test is commonly used in clinical and research settings to screen for cognitive impairment, track changes over time, and support the diagnosis of conditions such as dementia and Alzheimer's disease. The MMSE takes approximately 5 to 10 minutes to administer and is particularly useful for evaluating older adults. While it is easy to administer and interpret, results should be considered alongside other clinical assessments, as the MMSE may be influenced by factors such as age, education level, and language proficiency. Here are the top 5 beneficial uses of the sample exam. 1. Early detection of cognitive impairment. The MMSE helps identify early signs of cognitive decline, allowing for timely intervention in conditions like Alzheimer's disease or other dementias. 2. Monitoring disease progression. It is useful for tracking changes in cognitive function over time, enabling clinicians to evaluate the effectiveness of treatments or disease progression. 3. Baseline cognitive assessment. The MMSE provides a standardized baseline for patients at risk of cognitive decline, assisting in future comparisons and clinical decision-making. 4. Screening in clinical settings. The MMSE is a quick, practical tool for primary care and hospital settings to screen for mental status changes in patients. 5. Support for diagnostic processes. It complements other neuropsychological assessments to support differential diagnosis of psychiatric or neurological conditions.